turning into an open wound, that there was something wrong, and I went and got a biopsy, and the doctor said we have to do a complete mastectomy, and we need to do radiation and then chemo, and we can't do a mastectomy until we shrink the tumor because, as you can see, there's no space there. So I went to work and I said, I'm not doing it. And I met with a lot of flack from that. My general manager was completely opposed to what I was doing. And I knew if I went through chemo and radiation, I wouldn't live through it. I knew in my heart that I wouldn't live through it. So I just kept trying to do different herbs and, SAFT, I tried everything, pretty much.
We do that too, so I know all about that for years. SAFT is very good, but in itself...
Do you want to talk a little bit about what happened after you and I got together? Or how do we got together? Tell these people how we got together.
Yeah, how we got together. I was at work and I didn't realize that advanced cancer is very painful, and I was in such severe pain. I asked to leave work early, and one of my friends said, why don't you go down to the herb corner, see if they have, because you believe in herbal remedies. So I said, okay. I didn't know what I was going to do. So I went down there, and the doctor's friend, Vern, was down there doing iridology. And he said, what's the pain from? And I told him. And he said, I have a friend who's doing a clinical study on a product he's trying out. Would you like to participate? And I said, yes. I mean, I just knew immediately that was the right thing.
I'm going to pass right now, Doctor.
I just knew that was the right thing to do. And then he started telling me a little bit about the therapy.
I know, I could have...
And the doctor, and it's funny because I said, is he about 5'8"? And he says, yep. I said, stocky? I knew exactly what he looked like before I even saw his picture.
Really?
Isn't that funny? Yeah.
What did you say? I'm sorry?
I said, I knew exactly what he looked like before I saw his picture.
Oh.
And so then we both called the doctor from the herb corner, and he set up an appointment, and then the next day came to my apartment and examined me and saw what he saw.
So you never really had any chemo or radiation or
I never
anything?
I never went back to the doctor after I got my initial biopsy report.
Okay, and then when did you meet Dr. Friedez then? Is it soon after that?
4.5 months later.
Oh, wow.
And I worked until all the way straight through then. And it was just getting harder and harder.
Right.
I was just, pushing myself. I didn't know what to do. I was just kind of lost.
Wow.
So
how long ago was it that you met Dr. Friedez?
about 6 weeks.
6 weeks?
Yeah, about the same as you.
Wow.
About 6 weeks.
Yep, that's correct. 6 weeks in Bioxyte.
Today, probably 6 weeks.
Of course, she takes, as I was explaining before, she's not only orally, she doesn't take only enterally. She's also taking it externally, just like when the time of the isotope for you.
Yeah, right.
And we are going to do some external also on you, okay? We have to still bend a little corner in there. What is happening with James McConaughey is outright miraculously. That's just like yours, it's like her case and like my case, I mean, these are we saying that we are in the presence of a cancer cure? Yeah. Just like that, because I don't believe this, which is all it is about it, You realize that we had it about 3 or 4 weeks ago, an item in the local paper in Florida Today, and this just gives you an idea where we are by saying Florida Today, where people, typical neighbors from the area, went on to disclose what was their expenses to get to die of cancer. $400, $500, $600,000, and either the husband or the wife was no longer home. They all died. People had to sell their home, liquidate their wealth, to pay this infamous machine of chemo radiation with no results, with false hope, just like they were giving you.
Right.
Okay, you're right to a point that you want to fantasize that these results from laboratory are not even accurate. Because how is it that so quick the thing is back? And now more morbid than before.
Yeah.
And Linda's case, it was metastasizing already to other organs already.
Work, so, you know,
Yes.
and stuff like that. And he just says to me, whatever you're doing, keep on doing.
It's a miracle.
He was like very impressed. And that's all they can tell you. I did tell him what I was doing. My husband did, because Al just came out and he said it. He says, oh, okay, well, keep doing it. It's wonderful. And that was it. I'll see you in 3 months. So he's going to keep checking me, and that'll be good, you know, just to get the CAT scans done so it doesn't have to come out of pocket. The insurance is paying for that. But I'm feeling great.
Yes.
I really am feeling
I can't believe
great.
how
I
beautiful
wish-
you look, girl. Oh. I mean, I remember this woman with no hair. No hair at all, huh? I'm severely drawn out. I mean, totally wasted, you know. I mean, wasted she was. And not just wasted physically, because you have to admit, Linda, you were emotionally and mentally
Oh, yeah.
deranged. I mean, she was just gone body.
Well, you also go into a state of depression,
Yes.
you know, because you think you're going to die. I mean, this is it, you know, and all the things that you read, and, you know, with a lot of cancers, especially what stage you're at, they only give you like 5 years to live. And, you know, that's a terrible thought to put into your head. You have 5 years.
And 5 years is an optimistic, you know, forecast, because most of the patients don't do 2 years, 3 years top, you know.
Right.
And,
Oh, yeah.
And either radiation or chemotherapy kill you, or you die of the cancer itself. So there's no escape to this, you know.
No, definitely the your protocol with the right foods to eat and the right supplements to take and
Yes.
everything, and especially when it's not at risk to your body. That's the great part. You know, I can't OD on the
That's
bioxide.
correct. No,
You know, you
cannot.
can't do it.
And you cannot envision any side effect, because there's none.
Right. No side
The,
effects.
the,
right?
the metabolic process of bioxide wound up on salt, infinitesimal traces of salt in your body. Now, Linda, would you mind talking a little bit about how difficult it was for you to comply? Because you said you addressed the issue of supplements, because that's the terming word that we have to use in America for our phytomedicinals. See, we are not allowed by law to say that we have medicine. And so we speak of supplements. Now, Linda went through a course and a program of supplements that are not supplements. And Bioxyte most certainly is not a supplement. And so did James. And so will this girl. Okay, she will go an isotope course also very soon. So,
What
so
are you taking, Diane?
Just bioxide.
Just bioxide. Okay. Yeah.
just
And that's it, yeah, because I was taking, oh my gosh, I was on a lot of medication, right?
Yes.
I was on Darvocet for pain. I was on, oh my goodness, just so many things. And now when Dr. Friedrich just told me, want you off completely.
And then what happened with your pain when you started Bioxyte?
And no pain.
No pain.
That was the best
in
part,
24
too.
hours.
In 24 hours, right.
Really?
I had no more pain. I wasn't taking any more Darvocet. I wasn't too tired, you know. It took a while for my energy to come back, but it did. Like, I'm so energized right now.
I can see, you know, your eyes are really clear
Yeah.
and sparkly. Wow.
So it's just amazing. It's just, and just what, 5 or 6 weeks that I've been doing this? I'm just looking forward to when it's, I don't have to do the Bioxyte.
I'm not supposed to say that.
I know.
Well, it's funny to
It's
make
very
a-
strong tasting, you know. It's, well,
And the odor
what does
too.
it taste like?
The odor.
Yeah, but you know what? I
Yeah,
keep saying
yeah.
to myself when I take it, this is going to, you know, make me better. It's,
Right.
I don't, you know, my cancer's going away, you know. Why not? I have to. I'm going to, if I want to live.